Yeah, okay. Don't panic. This will be okay. I'm just gonna check how you're doing. Alright? Alright. Okay, now calm down. You can sit right there on the chair in front of me. Yeah, just be careful, just sit down. There you go. Alright. Now, what happened? Alright, you fell. Did someone push you? No, you just tripped. Alright. And when you fell, what happened exactly? Can you tell me that? You don't remember? No. Is there anyone who might have seen what happened? You don't think so? Alright. I'll ask around a little later, okay? Alright. I'll help you now. So, could you just take a few deep breaths for me? I'll do it as well. Just in. And out. There you go. Again. Alright. In. And out. Alright. That's way better. So, what looks like that happened is you fell forward when you tripped. You tried to break your fall using your hands, but you still ended up hitting your head on some kind of hard object, like a stair, maybe a rock, maybe the sidewalk. Yeah, you were walking on the sidewalk. Alright. Okay, so that probably happened. Now, this can just be temporary, the memory loss, because of the shock, and the memories can come back later again of what happened exactly. Saying that you do remember what happened just before that and where you were is a good sign. And I think it might just be the shock, but I want you to keep trying to remember, alright? There might be some kind of head injury. I can't tell right now because I don't have the equipment to check properly. But what I can do is I can take care of the wounds you have on the outside. So your skin is pretty scratched up and a bit dirty from the dirt on the pavement. So what I will do is I will clean the wounds, see if you need any stitches, if it's really bad, if it's bleeding really bad, or if it's not bleeding at all. And once I cleaned the wounds, checked everything, I can bandage them for you. And once I did that, you can probably stay here for a little longer. We still have a bed available, and you can rest for a little. I don't want you falling asleep, but you can rest. See if you get any more pain, like a bad headache or something that seems off, and you can notify me, and when I think it's needed, I can take you to the hospital. Alright? Okay. Is it okay if I first take a look at your hands? Yeah. Could you give them to me? palms up. There you go. Thank you very much. So, you have some scratches. Your skin is open. It seems like there is some dirt stuck in the wound. But it shouldn't be a problem. We'll get it right out. Alright? Alright. Now, I have some disinfectant for wounds right here. And this I will spray carefully on your hands. It's a bit cold and it might sting. Yeah, it won't hurt too much, I promise. Alright. Alright, I'll start with your right hand. There you go, you're doing such a good job. Now, your left. There you go. I know it stings. You can blow on it if you'd like. It helps cool it down. There you go. Alright. Now, I'm going to get my tweezers and pick out that large piece of dirt right there. That will hurt for just a second and then we're done. Yeah, then I can put on some ointment and I'll bandage them up. Alright. Now, I have my tweezers here. It's going to hurt for a second and then you're done. I'll count to 3, yeah? 1, 2, and 3. There you go. Now that wasn't so bad, was it? Exactly. You're doing so good. I'm really proud of you. Now, I'll just rub in some of this ointment right here. Yeah, it feels very soothing. Won't hurt at all. There you go. Alright, this will prevent new dirt getting in there and it will stimulate the healing process. Alright, now I'll bandage them up for you. There you go. And just be careful with your hands, alright? You have to use them, of course, but make sure you don't get any dirt in them. And when washing your hands, try to use very gentle soaps, preferably ones without any fragrance. Alright. Your hands should be good in like 2 to 3 days. Yeah? Alright. Now, I am going to take a look at your head. Yeah. Alright. So. Alright. You seem to have a little bit of a cut situation in your hairline on the right. It isn't too bad. Fortunately, it isn't really deep or anything. It's just bleeding a lot. And I think that might cause you to be a little lightheaded. How do you feel? Yeah, I thought so. Alright. So what I'm gonna do is, again, I'll disinfect it. I'm going to put on some ointment. Then I'll put a bandage on it. Yep. Alright. Now, I want you to close your eyes for me so I don't get any disinfectant in your actual face, and just on the spot that needs to be treated. Yeah? Alright, just one spritz, then it's done. Yeah, this is gonna sting a bit. There you go, there you go. Alright, now I'll do this quickly. Here. There you go. That's the ointment. And now it's already bleeding a lot less because I blocked the entrance just like I did with your hands. Now I'll put the bandage on it, and then you're good to go. And you can rest a little here. Yeah? Alright. Just gonna stick it on there. Right there. Alright. That's nice and secure. So, you can take the bed on your right, and you can just lay down. You'll be completely safe here until you feel a bit better. And if anything worsens or you don't feel comfortable or maybe even nauseous, whatever it is, just call out to me and I'll be right there. I'll help you. Alright? Alright. There you go. I hope you rest well.